Chapter 5, Video 3. We're going to talk now about the things that we need to report to the nurse immediately. If we notice these symptoms, we need to definitely report it. If you notice coughing or wheezing, diarrhea, constipation, difficulty breathing, fever, a low reading on the pulse ox monitor, this could mean they're not getting, that something's in their lungs, that they're not exchanging oxygen like they should. Abdominal pain, bloating, cyanosis. Cyanosis is a bluish discoloration to the skin. We will see that often if they're not getting the oxygen that they should to their body. Dry mucous membranes, this could indicate dehydration. Nausea, vomiting, decreased or very concentrated urine. One thing that we need to do too as well with these guys is we need to make sure that we provide very good oral care with these people. Even though there's a tube going down their throat or it may be stuck into their stomach through the abdomen, we still need to provide oral care, okay? We need to make sure that every 2 hours we're moistening those mucous membranes and we're giving them thorough care. We want to make sure also that we provide good skin care after a bowel movement, because these bowel movements can be very loose and they can become irritating to the skin. All tubing, feeding bags, bottles, tubing, all of this needs to be changed every 24 hours because we want to make sure that there's not any bacteria or anything growing in that tubing that can make them sick. Again, low oxygen levels and that cyanosis. That cyanosis is that bluish discoloration, and that's a result of low oxygen levels. We need to make sure that we're reporting that to the nurse immediately if we see that. We talked earlier about total parenteral nutrition. Total parenteral nutrition, remember we said, goes directly into the bloodstream. So remember we said TPN differs from enteral because TPN doesn't go directly into the digestive tract. It goes directly into the bloodstream, so it's not digested. It's administered through a central line in one or two of the large veins that empty directly into the heart. So you can go up here and see that it's entered into the jugular vein, or it can be entered into over here the superior and inferior vena cava. We want to make sure that the dressing that's holding this line in place stays intact. If it does get to where it looks like the dressing is dislodging, we need to make sure that we let the nurse know. One thing too that we want to monitor closely with TPN is the patient's blood glucose levels. Because it's full of sugar and nutrients, it can drive their blood sugars really high. So that's one of the tendencies that we see with patients who are receiving TPN through their vein like that. TPN is a solution that contains nutrients, and it's nutrients in their smallest forms, okay? We give this to patients who are very ill, injured, or maybe recovering from surgery, especially like the gastrointestinal surgeries, and they may not be able to tolerate anything in their digestive tract. So this is when we use TPN. These patients are very sick. We need to, again, check that dressing, make sure it's intact. We need to let the nurse know if it dislodges, becomes wet or soiled, and we want to make sure that we monitor these glucose levels closely. A patient who is at higher risk are those who already have hyperglycemia or hypoglycemia. If they already have blood sugar issues, then, they're at more risk for their blood sugars skyrocketing. Again, it's very concentrated. It contains a great deal of glucose, and its nutrients in their smallest form. It goes directly into the bloodstream. So this is why monitoring those glucose levels is super important, because it's going straight into that bloodstream. Glucose levels should be monitored every 6 hours, okay? The patient that's taken off of TPN should continue to have their glucose levels checked, and we want to make sure that they don't bottom out. So when this TPN is stopped, it's very important that we continue to check their blood sugars, because they are used to running at a higher level, and when we pull this TPN solution away, their blood sugar could plummet. Question for you: what tests are performed on a regular basis on all glucose meters? The answer to this is going to be that quality control test. So on that glucose meter, that quality control test is a solution that is actually put on a strip. It mimics blood, but it tells you what range it should fall in. And if it falls within or outside of that range, then we'll know that we have a problem.